right, let's talk about Medicaid. It's a big deal, really. Think of it as a crucial healthcare program. The federal government and state governments work together. They provide health coverage to millions of Americans. These are folks who often have lower incomes. It's a lifeline for many, truly essential. Without it, many people would face impossible choices. Healthcare or rent, medicine or food. That's no choice at all. So who does Medicaid actually help? It's a diverse group. We're talking about children, lots and lots of them. Pregnant women also get vital care through Medicaid. Seniors, particularly those needing nursing home care, rely on it. And, very importantly, people with disabilities are covered. As of early 2025, around 72 million people were enrolled. It underscores just how vital this program has become in America. It's not some niche thing. It's a pillar of the health system. It's a safety net, and a pretty important one at that. Now enter former President Donald Trump. He has made some rather bold claims about Medicaid. In 2023, he quite clearly stated, and I quote, "I'm the one who saved your Social Security and your Medicare and your Medicaid." Yes, you heard that right, saved. Like a superhero. He presented himself as the guardian of these programs, the sole protector standing between them and oblivion. It's a strong claim suggesting he actively protected them from harm. A very, very strong claim indeed. These declarations weren't just one-off remarks, they were part of his broader political messaging. You'd hear these lines at rallies and interviews. He wanted people to believe he was their champion, the champion of programs that many Americans rely on. It's a powerful political statement, designed to resonate, especially with voters who depend on these safety nets, or with those who simply believe these programs are important. So, Trump said he saved Medicaid. Let's look at his budgets. Every single budget proposal from his administration told a different story. Instead of protection, they proposed significant cuts to Medicaid. Yes, cuts. Not small trims, but substantial reductions. This wasn't a secret, it was right there in the budget documents. Year after year, the pattern was remarkably consistent. The numbers clearly indicated a desire to shrink the program. This directly contradicts the idea of saving it, doesn't it? It's like saying you saved a cake by eating half of it. Consider Trump's budget proposal for the year 2020. That plan included a cut of over $900 billion from Medicaid. This wasn't over a year or two, but over a 10-year period. Still, $900 billion is an enormous sum of money. This would have dramatically reduced federal funding to states. States rely on that federal money to run their Medicaid programs. Less federal money means states face very tough choices. They either have to find the money elsewhere or cut services. Section 4. The AHCA adventure, a close call for Medicaid's expansion. Beyond budget proposals, there was the American Health Care Act, or AHCA. This was the Republican bill in 2017. Its goal? Repeal and replace Obamacare. Former President Trump was a very vocal supporter of the AHCA. He heavily pushed for its passage through Congress. He saw it as fulfilling a major campaign promise. The Affordable Care Act, or Obamacare, had expanded Medicaid. Many states chose to expand coverage to more low-income adults. The AHCA had big plans for this Medicaid expansion, and those plans were not about strengthening it. The AHCA aimed to do two major things to Medicaid. First, it proposed to end the ACA's Medicaid expansion. States that had expanded would see that federal support phased out. This would have reversed coverage gains for millions. Second, it sought to cap federal Medicaid funding overall. This would have been a fundamental change for the first time. Instead of open-ended matching funds, states would get a fixed amount per person, or a block grant, a fixed lump sum. This would limit future federal spending significantly. Section 5, the work requirement ruckus, making it harder to get help. Another key policy pushed during the Trump administration was work requirements. The idea was that some Medicaid recipients should have to work, or they should be in school, job training, or volunteering. If they didn't meet these requirements, they could lose coverage. Trump's Department of Health and Human Services actively encouraged states. They used waivers to let states test this approach. The argument was that it would encourage self-sufficiency, and it would ensure Medicaid was only for the truly needy. But the reality on the ground proved to be much more complex. Arkansas was the first state to actually implement these work requirements. The results there were swift and, for many, devastating. Within just a few months, over 18,000 people lost their Medicaid. That's a significant number of people losing health care. Supporters might say these were people not meeting the rules, but investigations revealed a more complicated picture. Many who lost coverage were reportedly already working, or they should have been exempt due to illness or other reasons. The system itself seemed to be a major barrier. Section 6. America's take turns out people actually like Medicaid. So what do everyday Americans think about Medicaid? It turns out the program is actually quite popular. This might surprise some politicians, but it's true. Polls consistently show that over 70% of Americans view Medicaid favorably. That's a strong majority, cutting across various demographics. People seem to understand its importance as a safety net. They recognize it helps vulnerable friends, neighbors, and family members. This widespread support is a crucial piece of the puzzle. It helps explain why some politicians might want to claim they support it. This popularity isn't just a vague, fuzzy feeling. When asked specifically about cuts, the public is clear. A majority of U.S. adults actively oppose cuts to Medicaid. They don't want to see funding reduced for this program. They understand that cuts have real-world consequences. Fewer people covered, reduced services, more medical debt. This public sentiment creates a tricky situation for policymakers, especially those who ideologically favor shrinking government programs. It's hard to openly attack something that so many people value. This widespread public support likely fuels some of the rhetoric. When a program polls well, politicians notice. Section 7, the grand disconnect, Trump's words versus the cold hard facts. So let's bring it all together, shall we? Donald Trump has repeatedly claimed he saved Medicaid. He presented himself as its staunch defender, its guardian angel. He wanted everyone to believe he was the one protecting it. These are powerful words, designed to reassure and win support. He used them frequently, making them a key part of his narrative. The message was clear. Under his watch, Medicaid was safe. He was the bulwark against any harm coming to the program. A comforting thought if it were actually true. But then we look at the record, the actual policy proposals, and a very different picture begins to emerge. Quite starkly, every budget his administration put forward proposed major cuts, hundreds of billions of dollars slated to be removed from Medicaid. Then there was the American Health Care Act, a bill he championed which would have cut Medicaid for 14 million people. It aimed to end Medicaid expansion and cap federal funding. This was not saving. This was a direct attempt to curtail it. It failed by the slimmest of margins, but the intent was clear. If you found this video informative, please like, comment, and subscribe for more content.